and public under the provisions of the local authorities and police and crime panel meeting due to the corona. Sorry, have I?
Yes.
Yes, that's right. In my screen. Welcome to this virtual meeting of the Scrutiny Committee. We welcome the public who may be listening to Islands FM or Council Facebook, and welcome to the press. And he's in another room today, I might start. I would like to confirm who is present. So I will call out your name, and if you could just confirm that you are in attendance. Councillor Sims.
Yes.
Councillor Legg.
Yes.
Councillor Marcus.
Yes.
Councillor Nelland.
Yes.
Councillor Smith.
Yes.
Councillor Watt.
Yes, here.
Councillor Williams.
Yes.
Paul Charnock, Chairman of Health Watch. Right. Paul Masters, Chief Executive.
Yes.
Ashlyn Khan, Senior Manager for Community Services.
She's on leave, Chairman.
Thank you. Tanya Satter, Senior Officer for Infrastructure.
Yes, I'm here.
Thank you. Bob Dawson, Officer for Scrutiny.
Yes, here.
Stephen Taylor, Deputy Monitoring Officer.
Present, Mark?
Yes. Russell Ashman, 151 Officer.
Not on the call, I don't think, Chairman.
Right, thank you. Whitney Curry, Public Health.
Yes.
Thank you. Dr. Chris Pickin, Lead GP, St Mary's Health Centre.
Yes, thank you.
Yes. Amy Langdon, Business Owner Briar and member of the Local Outbreak Engagement Board.
Yes, I'm here.
Thank you. And Dr. Rob Lambert, Independent Person.
Yes, I'm here. Can you hear me?
Yeah, thank you very much. That's lovely, thank you.
Chairman, we've got one or two people on telephones. I'm wondering if we've maybe got one or two other people here.
Right. Can you shout out your name, please, if you're on the telephone?
Councillor Roger.
Right, thank you. I think that must be Bob.
Yes, we also have Nicholas Stinson, our Senior Manager for Strategic Development.
Nicholas Stinson, thank you. Right.
Is there anybody who has not spoke as yet? Please make themselves known.
Councillor Davis is in the gallery.
Thank you.
And Fran Grottick observing.
Thank you.
Thank you, Chairman.
Thank you. After each agenda item has been presented, I will go round members and officers by name for you to ask questions. When it comes to voting, I will take silence as consent. If anyone wishes to vote against or abstain, please make yourself known. I would like to welcome Councillor Williams, who has joined the Scrutiny Committee, and we hope you will find some enjoyment in it. I've got some thanks here on behalf of the Scrutiny Committee. On behalf of the Scrutiny Committee, I would like to offer our thanks to Jackie Pendleton, who has retired from her post as Chief Officer at NHS Kernow Clinical Commissioning Group earlier this year. She was a great supporter of these islands and made sure our voice was heard in wider health and care discussions, and we wish her a most enjoyable retirement. I'd also like to welcome her successor in the role of Joint Accountable Officer for Public Health and Care, Helen Charlesworth May. She's unable to be here today. Helen brings a wealth of 30 years' experience in the NHS and health and social care, and we shall look forward to meeting her. Thank you. Right, we now go to agenda item number 1. Any declarations of interest? No. Item number 2, the minutes of the previous meeting. Are there any comments for these minutes? Councillor Legg, I think you have some comments.
Yes, I was just wondering if the Officer for Member Liaison could compare the minutes with the Facebook recording around my questions to Stuart Reid, please.
Okay, we get that done.
Yeah, thank you, Chairman. I will go and do that after the meeting.
Any other members got any questions? I have one question to the Chief Executive, please. I'd just like to know that all the resolutions we passed, have they all been activated? Paul?
He seems to have frozen.
There you go. Sorry, Chairman, the mute button wouldn't go off. I do apologise. Yes, I think particularly you're probably interested in the issue about the ongoing lobbying and support with ministers, etc. I think that's what you're referring to, Chairman. Yes. And absolutely, yes, not just before the 25th of June, but also onwards. And to give you some scale, all the way through June, we were lobbying the Tourist Minister in conjunction with Cornwall for clarity around the guidance to the hospitality industry. As you know, that was causing some concern, and we'll probably come on to that later on the EVAC plan. The Chairman also wrote a letter to the Department of Transport around the exclusion so far of support to the helicopter from the transport grants that we've been receiving, and we followed that up again. We've also done a letter to George Eustace and to the Chancellor concerning the uptake of small grants. If you remember, there's a gap of about £400,000, and we've been asking either the Treasury to make up £400,000 or to allow us to utilise some of the DEFRA funding for small grants. We're still awaiting detailed responses to those letters, Chairman, although from talking to Derek Thomas yesterday, I don't think it's going to be a positive answer, but we will continue to lobby on those. Alongside Cornwall colleagues and with Malcolm Bell, we've been lobbying ministers, the Tourist Minister and the Chancellor for tourism business support, particularly for the Three Winters scenario. And I believe even today there's a further lobbying letter that's gone off on behalf of South West Councils to the Tourist Minister, asking for that to be taken up directly with the Chancellor. And we're currently drafting a further letter to the Department of Transport because, as I've mentioned informally to members, my big concern at the moment is the ending of the subsidy or the grant to the transport operators at the end of July, and no response yet to the business case that we put in for ongoing support to March, and that's causing a lot of angst, I think, and a lot of risk for the islands. So, yes, Chairman, in short.
Right, thank you very much. Any more questions? Could I have a proposer for the minutes, please?
I'll propose Steve Sims.
Councillor Sims has proposed. Could I have a seconder?
Councillor Legg.
Thank you very much. All those in favour? Silence means consent. Thank you very much. Agenda item 3, I have no urgent items. We now come to part 1, agenda item number 4, which is the Isles of Scilly evacuation service. I'm going to ask the Chief Executive, Paul Masters, to introduce this report, which will be followed by the public health perspective from Whitney Curry, who is the public health lead for the Isles of Scilly incident response team. After that, I will ask Dr. Picken for his comments. So I'd hand over to you now, Paul. Thank you.
Thank you, Chairman, and I hope you don't mind me having a little bit of time just to sort of give the history to this. And as you said, I'd like specifically to hand over then to Dr. Whitney Curry, the advanced public health practitioner, to go through some of the public health challenges that we've overcome, and also, Chairman, with your acceptance, also perhaps to bring in Nicola Stinson particularly I know there were some concerns around transportation on the islands and logistics, which may well be worth bringing to your attention as well. I think also some of the questions and concerns that have been brought to the committee's attention are why the council felt in the first place that in arranging such a scheme was an appropriate thing for the council to do, and whether or not it was a justifiable use of public funds. Obviously, you know, we are in unprecedented times dealing with a new virus and a pandemic, and you will recall, Chairman, that this resulted in us calling a major incident back some months ago, which was also the case across not only Devon and Cornwall, but the rest of the country. That major incident put in place an awful lot of preparations in order to how we would deal with an outbreak on the islands, and as those preparations became more and more robust, it was decided at the end of June to stand down from a major incident for two main reasons. One was that the plans were felt to be robust by all partners and all agencies, and the second was the fact that the responsibility for outbreak planning transferred to the Director of Public Health on completion of an outbreak plan which had to be completed by the end of June, which was done across the country. And I've been informed by Department of Health colleagues that the South West is viewed nationally as best practice in terms of the way that Directors of Public Health have cooperated across the region in terms of information sharing and putting their plans together. However, in parallel to all of this, there's the economic impact on the islands and on the country, and it's worth reminding colleagues that actually that impact is still yet to be felt as the particular subsidies that we have received come to an end. And it's worth us reminding ourselves that the Isles of Scilly economy is over 85% tourism related, and therefore is much more vulnerable to any shocks that come through the tourism sector. And whilst, of course, the support the government has given us has been welcomed, the long-term impacts that are yet to emerge are going to be most pressing for the council and our community. And one of the major ones that I've already alluded to is the end of the subsidy to the transport network, which ends in July, which is currently receiving over £1 million per month in subsidising that scheme. And we've requested a further 15 million evacuation plan. And you'll recall, Chair, that in June, there were rumours that the 4th of July was going to be a date that the tourist industry or the hospitality industry was going to be allowed to open up. But there was no detail and there was no confirmation of that date. And increasingly operators, be it B&B, be it hotels or be it transport operators, were increasingly concerned about the lead-in time for them to take due considerations in place in terms of what they needed to do to prepare to welcome visitors back to the island. So with no confirmation of the guidance, we decided to see what we could do to try and get some clarity, because you'll recall, members, that you asked me particularly to try and come up with some solutions working with the business community about what we could do. So early on, at the beginning of June, I liaised with Malcolm Bell and Visit Cornwall about what was happening at the lobbying of the Tourist Minister for clarity on the rules. At that time, the only guidance that was available was the World Health Organization guidance, which was about if you stayed in a hotel and you became poorly that you should go home, which was mirrored in the UK hospitality guidance. And we also liaised with the other islands, such as the Isle of Wight, the Shetlands, the Orkneys, and the Channel Islands, etc., about what plans they all had in place. But we were all doing it separately without any guidance. Towards the middle to the end of June, there was a conference organised by the Tourist Minister, and the civil servants told us that the advice that was likely to emerge would be the same advice that was issued by the Scottish government in advance of the English government. And I did send that to members, and in that guidance from the Scottish government at that time was again that people should be travelling home if they could safely. And therefore that's why the beginning of the conversation about what we should do there began to emerge. We also at the same time carried out risk assessments with the island partnership about whether other alternatives could be provided, such as alternative accommodation, etc. But that became more and more complex the deeper and deeper we got into it in terms of refunds, subsidies, etc., etc. In parallel to all of this, Chairman, the Tresco Estates had already explored the use of the jet boat for their own purposes in liaison with the Director of Public Health. And leading on the back of that, a conversation ensued with the transport operators about whether the jet boat and a helicopter could be made available as private transport in order to be offered to anybody who could offer some confidence to people wishing to come to the islands. I took the decision, and I'll come on to how in a minute, Chairman, that working in partnership with the transport operators, it would be a good use of public funds to contribute to a joint fund with two of the operators to pay for that. And that fund, that £50,000 that we've earmarked from the council, came from the COVID fund, which was an amount of money that the Isles of Scilly Council has been given for COVID-related costs. It was not out of the council's core budget, Chairman. I think that's quite important that taxpayers realise that. Since that time, there's been a massive effort to seek support for the scheme, with obviously a lot of input and challenge from a public health perspective, quite rightly, and Dr. Whitney Curry will outline that later on, because obviously I'm not qualified to get into that level of detail. And I recognise that the concerns brought to the attention of the council are, first of all, the use of public money and the reasons for it. In consultation with the council's 151 officer, and for those members of the public who don't know what that is, it's the person who's responsible for ensuring prudent use of public money for the council. We felt that it would offer some confidence to the business community to help people feel that if they travelled to the islands, there was a way for them to go home if they were able to. We also needed to show to government that we were doing all we could to restart our economy, because we're being watched very closely in terms of the subsidies we're getting to see how self-reliant we can be in restarting our economy. An early intervention to try to offer some confidence would be a good use of public money and might hopefully safeguard some businesses who might otherwise suffer, which of course ultimately would impact on our own income through business rates, etc. I think the other point is, and there was some debate I've seen in terms of whether this truly is a private transport offer, whether it's a public transport offer in terms of the fact that it's government money. I would say it is private transport, Chairman. It's not open to everybody. It's subject to evaluation and approval, so it's not open to all just willy-nilly if they want to use it. I've done all of this, Chairman, in consultation with the 151 officer and the monitoring officer, and you yourself will be aware that in consultation with the Chairman and the Vice Chairman and on informal members' meetings, I've tried to keep you up to date as the scheme has progressed. I know also, though, there are some concerns about who's responsible for this scheme, and I want to be clear, Madam Chairman, this is a council intervention, and therefore it is the council on the guidance of public health that's responsible for this scheme, and therefore ultimately myself. We've also brought the scheme to the attention of our local MP, who is very supportive, and he also has brought it to the attention of Kelly Tolhurst, who's the Transport Minister, to ensure that government is aware of what we've been doing. You'll also note, Chairman, and I'm coming to the end now, that in the report we've included various groups to be consulted, and just to update the report further, last Thursday, the Cornwall and Isles of Scilly Health and Care Incident Command Centre, on its minutes from Thursday, were in full support and agreement to the robust plan on evacuation put forward by the Isles of Scilly. And just to give members some confidence on who sits on that group, it's South West Ambulance Trust and the Chief Executives of Kerno CCG, RCHT CEO, the CEO of CPFT, Adult Social Care Helen Charlesworth May, and some GP representatives as well. And on Friday, the evacuation scheme went to the Cornwall and Isles of Scilly Health Protection Board. And you'll recall on that board, Madam Chairman, it's chaired by the Director of Public Health, Rachel Wigglesworth, but also from a medical point of view, it's the Strategic Planning Consultant for Peninsular Pathology, the Chief Nursing Officer and Emergency Management Lead for KCCG, Military Liaison, Adult Social Care, the Clinical Director from the KCCG, and the Director of Infection Prevention Control from RCHT. And they received the report on Friday and were content with it as well. And only this morning, I've attended the Cornwall and Isles of Scilly Health and Care Partnership Senate, and I reported the evacuation plan to that forum, as well as it's also a publicly observed meeting. Whitney will also go on in terms of national advice on that as well. But I'd like to close, Chairman, by saying I'd like to thank everybody on the Isles of Scilly for working together to try and find a solution to this problem. I'm sure people will have concerns with it, both sides, but we've done the best we can in terms of the unusual situations that we have faced. I note also, Chairman, and I sent to members last night the guidance from Cornwall to holiday operators in Cornwall, and you'll have noted in that report that they too are encouraging people to go home if it's safe to do so. But however, they've not put in place as many safeguards as we have on the islands in terms of making sure that it's done as safely and as appropriately as we can. So with that, Chairman, I'd like to bring in, if that's okay with you, Dr. Whitney Curry, the Advanced Public Health Practitioner.
Thank you, Paul. Thank you, Chairman. I think it's really important if I give a little bit of a background about the outbreak planning and how we got to this point in terms of public health perspective. So, as my colleague Paul will have already said, this evacuation plan sits within the overall outbreak plan for the Isles of Scilly, but it also sits within a couple of other documents. It sits within the Cornwall and Isles of Scilly Local Outbreak Management Plan, which Paul referred to earlier, and we were required to have prepared and ready for use by the end of June, which it was. It's a publicly available document which you can access online. So I would encourage members of the public to have a look at that document and see where the Isles of Scilly sits within that document. You'll notice within that document that the Isles of Scilly is its own breakout section. There are several very important priority settings within that document, which include schools, care homes, workplaces, and then Isles of Scilly is also its own separate bubble, as it were. I think they're even bubble-shaped in the document. So the Isles of Scilly, it was very clear as we were working on that local outbreak management plan, had its own complex issues, not the least of which is the transportation on and off the islands for visitors and anyone who might become ill. And so at the time we were working on that local outbreak management plan, we were giving the Isles of Scilly public health support, and it was clear that we needed to provide more dedicated public health support. Therefore, I was assigned as full-time being able to support the Isles of Scilly with their outbreak management planning. So I lead from a public health perspective, and we've been able to develop across our partners with Isles of Scilly and Cornwall Council a really robust outbreak plan. So that's a bit of the background. It also sits within, there's lots of plans going about, but it also sits within the regional outbreak management plan. So this is the Public Health England Southwest outbreak plan. So all of our local plans and Cornwall and Isles of Scilly plans sit within that. Therefore, all of our plans have had to be approved in order to be incorporated into that larger regional plan. So to say that everything that we've provided to Public Health England Southwest, we've been updating them week on week with our progress. We've been getting feedback on that, and actually the plans that we've used have gone on to inform our other public health colleagues in the Southwest in other local authorities. Really important to note that as we've developed this outbreak plan, it will continue to change and evolve. So an outbreak plan is your best plans with the information that you have at the time. And what we do every day is we look at what we've learned based on what's been going on the islands when we've had to enact aspects of the plan. So it's continuously under review, continuously updated, and it's a live outbreak document, which does include the evacuation plan. So in the process of developing the evacuation plan within that outbreak response plan, we decided that it was really important that we were considered as Isles of Scilly one of those very important complex settings, as I was saying, schools, workplaces, care homes, war. And we needed Public Health England to recognize that in order to make some of those systems and communications work and to make sense. So we met with Public Health England, Isles of Scilly Council colleagues, and our public health colleagues with Cornwall Council to agree with Public Health England that we would be designated as one of those complex settings. And the benefit of that is that once you are designated as such, Public Health England then have the overall oversight of every single aspect of that process. So right from picking up anyone who might have a cough on the Isles of Scilly, right the way to the end of the process, if it's a guest who is deemed appropriate to evacuate back to their home, Public Health England has that oversight and approval of the entire process. So they have the input, they have the challenge, and they can shut it down if it's a situation where it's deemed not appropriate to evacuate a person at that point. Once we get to the point where we would consider to evacuate someone back to the mainland, it's really important that we remember that each and every case is risk assessed on its own individual issue. So that's right down to how well the person is to travel. If they're quite ill, we are not making them travel. Do they have a way to get back to their home that doesn't require public transport? That's really important. That's a main part of the guidance. And if they don't have a way to get home that does not require public transport, we won't be sending them back to the mainland to do that. We're really, really clear. If they've spoken to their clinician or 111 about their concerns about their symptoms, and that clinician has deemed it not appropriate for them to travel, they won't be traveling as well. So really important that we're taking all of those risks into account. So that's in terms of the individual. In terms of the actual transportation components of the evacuation plan, every aspect of that evacuation plan has developed a risk assessment document for which Public Health and Public Health England have been able to review and approve. The Director of Public Health has endorsed these. Public Health England have endorsed the transportation risk assessment plans and have deemed them appropriate, with the caveat that every case will be risk assessed on its own merit. So if the main take-home message is there is no one-size-fits-all solution for anyone getting off the island should the case arise, but there are really robust plans in place to be able to assess the appropriateness of moving someone and the methods by which they would be moved. So I want to make sure that you've seen how much scrutiny has gone over that. And the other thing to pick up on is that there is no 100% safe when you're in a pandemic. I feel compelled to remind everyone that we are in the same position we were when the pandemic hit. There's no vaccine. We know a lot more than we did before in terms of prevention and how it spreads, but there's no risk-free movement of people these days. So as we open tourism, we need to remember that nothing has changed in terms of how this bug spreads. We just know how to avoid it. And one of the ways that we can make sure we're doing that is being prepared for the worst, being prepared in terms of our outbreak planning, the way we can control outbreaks and pick up any symptomatic, the way we can evacuate guests safely, should it be deemed appropriate to do so, but making sure that we are pushing those public health prevention messages: wash the hands, keep that social distancing, stay home if you've got a cough, fever, or change in taste or smell. And we've been really working on those plans, getting those public health messages out wide and far. So hopefully we don't get to the point in the first place where we have to evacuate people, but we're very well prepared should that event arise. I think Nicola was going to pick up some bits after this around some of the transportation specifics, but I wanted to give a bit of a background around the challenge that the plans have come under, the scrutiny that they've been under both nationally and locally, and the fact that they will continue to be challenged. This isn't just a write a plan on a page and move on. They are continually updated and reviewed, at the moment daily, to make sure that we're keeping up with the guidance and any changes that are going on the islands that we pick up. Thank you, Chairman.
Chairman, is it okay? It's Nicola. Is it okay if I just pick up on just the last issue very briefly, just to get an indication of the transport issues? And I think As Witness said, it is a bespoke solution for everybody, and each solution will depend on what location people are starting from. We've worked with each of the off-islands to look at transport options if somebody needs to go from their accommodation to the quayside. And we've also got a number of options in terms of boating from that quayside to either the quayside here on St Mary's, or if they need to get to the helicopter, or if they need to just get to the quayside to get a jet boat back to the mainland. Here on St Mary's, we've also got a number of options in terms of those visitors that are unable or unwell enough to walk between their accommodation and the quayside or the airport. So we've got vehicular transport provided, 3 options, minibus options, and also the utilisation of one of our electric vehicles, which has been adapted and risk assessed to make it COVID secure. So I'm confident that the plans we've put in place allow us a number of different options, depending on the needs of that individual and their party, to allow us to transport between islands, on islands, and then to evacuate off from there. So I think the level of, I don't know if we need to go into that level of detail today, but to be certain that there is both options for vehicular transport on all islands, including the off-islands.
Thank you, Nicola. I'd like to ask Dr. Pisking if you would like to comment further, if there are any areas that he feels that haven't been answered fully.
Yes, many thanks, Chairman. As people are probably aware, I'm a rather outspoken critic of this plan, and I believe there are a number of reasons why this should be. If I ask people to pause for a second, and let me just take you back 3 to 4 months ago to where we were. 3 to 4 months ago, we were in a position where we had anyone with suspected, and I don't say proven, I say suspected COVID, could only be transported through an air transport isolator through the military because the risk of transport was deemed so serious. Now, I would give my thanks genuinely to our MP, who I work personally with, to get legislation changed at central government level to allow emergency air medical evacuation to occur. We are now in a position where both local council, with the backing and endorsement of other people, are proposing that we transport, and I make this very clear, proven COVID positive people on a transport system that has not been assured, that there is not a robust transport plan in place. Plans will be developed personally and at the time. And this has, I believe, received risk assessment by the council, thereby accepting that there is increased risk and mitigation put in place. As we've heard public health tell us just today, no transport is 100% safe, and I would very, very strongly, and I think with the backing of my local healthcare professionals on the ground, put forward that there is actually a way to avoid this. People can remain at home, people can remain in their accommodation. Accommodation providers have been informed by the government that tourists or visitors would be required to pay for extended stays, so with minimum impact to local accommodation providers. And I would actually say that we are now deliberately proposing to transport proven COVID-positive patients or people amongst other members of the community, whether it be boatmen, whether it be aircrew, whether it be car drivers or taxi drivers, or perhaps walk them down the street. And I would add, in my 20 years of experience of air-medding patients for the military with assets like air transport isolators, I have never sanctioned the movement of infectious disease for non-medical reasons. And I accept that the council has said that this is their responsibility. I accept that many other organisations have agreed to the principles of this, but I would say to the councillors that it will be your responsibility to sign this off or not sign this off, and I believe it is very important to have this counterpoint argument to this. I've obviously written in detail to everyone concerned, and I'd be very happy to take further questions, but I think that probably summarises where I am and where the views of lots of my local, on-the-ground health professionals are also. Thank you.
Thank you, Dr. Picken. Paul Masters, would you like to reply to that? Have you anything more to say?
No, not particularly, Chairman. I think Chris has been quite consistent in raising those concerns all the way through, and I think they're understood and listened to, with due respect and importance. But I think, as I've tried to outline, we have also tried to get as much advice and guidance as we could, and that's what I think Carrie was trying to outline earlier to the committee. So I don't think it would be appropriate for me to go into any of those further details, Chairman.
Okay. I'm sure some members will have some questions for you, Dr. Picken, later on. But I'd like to ask Amy Langdon, who is a business owner on Briar and a member of the local outbreak engagement board, on her views of the evacuation plan. Amy?
Yes, thank you, Chairman. In my limited knowledge, it seems like a really good plan and a really good solution to what we've got in this tricky situation in our locality. Just got a few queries, mainly about off-islands. There's a lot of Nicola just said about there's options about transportation on off-islands. I don't actually know what these are. I'm not sure these actually have been made public. It would be nice to know, obviously, from all off-island accommodation providers, what actually will happen there. It seems to be a very generic plans in place on the off-islands, but yeah, as I say, we're not exactly clear what they are. As an accommodation provider, do I need to move people's luggage if they're being evacuated, or is someone lined up to do that? Who are the local points of contact? I do know that, but only because I've been told in my position on the outbreak board. I don't think anyone else on the islands does know that. Other thing, the public transport, obviously I appreciate why people travelling down to Penzance on public transport can't be evacuated, but in the nicest possible way, what do we then do with them? I know we have to encourage people to use their own private transport, but we can't police that. We can't insist on it. It's their choice. So again, what happens there, then they have to stay in the accommodation, and there's all the knock-on effects to that. I appreciate the government say the visitors are required to pay. It's not necessarily that straightforward, and we've got incoming visitors. What do we do with them? This is where maybe the safe house thing comes in. I appreciate, again, that's not easy. Where do we put them? What do we do? There's just lots of little bits in this report that aren't necessarily covered, I think.
Thank you. Nicola, would you like to reply to that?
Yeah, so on each of the off-islands, I think this is about comms, actually. I think on each of the off-islands, we've got a point of contact, and they're holding both the test kits and also the evacuation kits. They also are the key to providing the trip, if you like, the start of the journey. So we'll pick up on that, Amy, and take that offline in terms of what comms we need to get on the off-islands around who the key points of contact are. What would happen is if there were an outbreak and there was somebody who needed to get off, that key point of contact would be speaking to the accommodation provider and the evacuee and their party and working through that transport connection with them. So I'll let you. We'll work through that, and I think what we need to do is get the comms out to the islands to make sure they know the pathways. So we've done some flow charts around that journey, that pathway. It's perhaps explaining that in a bit more detail. So we've got some champions on the islands who can explain it to others. So all the accommodation providers are aware of what their role would be within that process. So it's a very good point, and we'll take that away. We can always improve on what we're doing, particularly around the comms.
That's great. Thank you.
Thank you very much. Right, we now go to any members. I'd like to start with Councillor Sims, please. Do you have any questions?
Yes. First of all, the issue of the public transport, in a way, it's a solution, but it's a partial solution, and the public transport aspect of it, when people get to the mainland, is an issue. And my main point I wanted to make on this. It's not really emphasised particularly strongly in the FAQs regarding public transport. It's just a one bullet point. I just think if it was put in bold, it would help. Then people might notice it more. And also, I have a question for Dr. Pickett. This was sent to me by a member of the community about 5 weeks ago, well before the EVAC claim. I knew the EVAC plan. And what he said was, and it was quite worrying when he said it, this was regarding people having to pay for their accommodation for possibly an extra 2 weeks. He said, well, lots of people are just not going to declare it. They're just going to wing it and go because they're not going to take a potentially £1,500, £2,000 hit. And I think the EVAC plan gets us around this, a long way around it. So it becomes a medical consideration because these people will not announce that they've got it to save money. Whereas if they can get onto the islands, they might. So I do think there is a medical benefit to this as well as just the economic. I don't know if you'd like to respond to that, Chris.
Thank you for the question. Honestly, I don't feel there is any medical benefit to this whatsoever. We know from public health guidance that similar to lockdown situations, that either people stay self-isolated or this virus spreads and this virus is lethal. I think perhaps my solution to that would have been that we could have used COVID funding to perhaps help support people in their accommodation or accommodation providers with that. However, that is obviously not the position that the council have chosen to take. But commenting from a purely medical and health-based perspective, we have all got to be responsible for our actions and we all must isolate if that is the requirement to do so. I think anything else will instigate an outbreak and we will all be, all of us, both from a health perspective and economically, much worse off.
Yeah, thank you for that, Chris. You get that?
No.
No, I think there was a plane causing some interference, Steve.
Chairman, we're waiting for you to rejoin us.
Okay. Let me just mute something else.
Just hang on a minute.
Right. Chris, just to reiterate a little bit, my issue with the visitors self-isolating here and incurring costs is that a lot of them simply will not do it, and because they don't do it, it possibly increases the risk of contagion as opposed to the evacuation scheme. And I think it could be a very real issue. I mean, if I was faced with a £2,000 bill on top, I would like to think I would declare it, but I certainly would think twice about it, and I think a lot of other people would too.
Chris, did you hear that?
Yep, sorry, I'm not sure whether Councillor Sims heard my last reply. However, it is probably also worth highlighting that an evacuation scheme will certainly increase, and I believe has increased, the amount of people who have decided to travel to the islands. So that is probably the flip side of that coin.
Okay. Councillor Sims, any more questions?
No, that's fine for the moment.
No. Right. Councillor Legg, do you have any questions?
Yes, just following up on that point about people would be better off remaining. If they are in accommodation with shared facilities, such as the campsite, in that situation, would it definitely not be better to evacuate them? I'd just like Dr. Pickham's opinion on that.
Again, I think if you read the new public health guidance, it says that there are areas or times or occasions when people should be considered for evacuation, for example. And when I read it, I take it to mean either when accommodation owners perhaps have health conditions which mean that they should not be around people who are COVID positive, or perhaps again in areas such as bed and breakfast where it's physically impossible. However, you will still have all those people potentially exposed, and in those cases, when you have perhaps negative swabbed people, those may be the occasions that you may wish to consider perhaps an evacuation, but certainly not for COVID positive.
Can I say, Chairman, that obviously the committee has to take advice from the accountable people who have already spoken. So I think that questions are best addressed to those rather than Dr. Pickin. Dr. Pickin is neither accountable nor a member of this committee.
Thank you. Councillor Legg, have you any more questions?
Yes, just one more question regarding the evacuation pathway on page 28. This mentions the criteria for whether a helicopter would be used or a boat would be used. Now, I'm sure these are only guidelines and that the final decision would come down to the skipper of the boat on the day in question. But could I just ask for confirmation for that, probably from Paul?
Nicola, would you like to answer that question? Oh, from Paul, sorry.
Paul or Nicola, whoever would rather. Paul, I think you're muted still.
It's Nicola.
I'll start, Nicola, and you carry on. You're quite right. I mean, obviously, the boat can only travel if the weather is benign enough for it to do so, and then if it's not that appropriate, then the helicopter is the second option. There is a cost element to this as well, and the value for money element. So, of course, all the points that Dr. Pickin has raised are absolutely valid in terms of safety on all those other issues, but also there's the fair use of public money, and therefore the boat obviously is cheaper than the helicopter, but the helicopter can operate in worse weather. So that each one would be assessed at its time, but the helicopter wouldn't be the preferred option.
And in terms of whose call it is, it's absolutely the skipper's call on whether it's appropriate to travel that day.
Thank you. Yeah, just I'm aware of other circumstances, other situations where on paper it might be acceptable, but when it comes down to a person's call, someone who knows the sea is obviously the person to go with. I would hate to see that money was being used to push something that was unsafe, and as long as the ultimate decision of whether to travel by boat comes down to the skipper, that is fine. So.
Thank you, Councillor Legg. Councillor Marcus.
Thanks, Chairman. I'd like to thank the officers and the public health officers as well for the plans, and also welcome the scrutiny of the plans as well by all the partners involved. It's really good. The only way we improve things is by people criticising them in an open fashion. It also kind of reminds me of the quote from Mike Tyson as well, that everyone's got a plan until you get smacked in the face. This really kind of, I think Chris's comments really kind of highlight the balance that government is trying to play between economics and health. And we can see in certain countries where governments have got that wrong. I'm not going to mention names, apart from the United States and Brazil, obviously. But I just wanted to ask a couple of questions, basically. Sort of flip Harry's question round and ask Nicola and Paul, have these plans been tested if there is, say, a mass event? The plans seem to me like they are treated for ones and twos or families, not if there's a group. So say if there's a group on a campsite, for instance, or anything like that. So have these plans been stress tested in that way?
If I can start and then Nicola can come in, I think that's a really good point. But I think we mustn't overlook the fact that, and Whitney might want to come in as well, is that this is a plan for limited numbers. If it became of a scale that the council or public health or health protection felt that we were unable to cope, then either we could declare another emergency incident, as we did before, and then utilise the mutual aid resources that are available to authorities in that time, or public health or health protection would also intervene in offering support and advice. So I think it is not expected that this is dealing with a mass event, because that would then be having to follow the outbreak plan. But perhaps Whitney could give some further guidance on that.
Thank you, Paul. I think you're exactly right. If you were to get an outbreak at that sort of a scale, it would almost make the evacuation plan null, because you wouldn't evacuate that many people at one time anyway. And if it were an event at that scale, Public Health England would take over entirely, and it would be a whole different sort of response in that respect, in terms of how we get people tested, how we make sure that they're isolating, and how we sort of proceed from there. It turns into a different story. This is for outbreaks that are smaller, that we can be assured that we are containing, and I'm really, really clear, if it doesn't make sense and we can't do it safely, we're not going to do it. So in that respect, although we'd have to individually look at a situation like that, I would think that it wouldn't warrant an evacuation procedure. It would warrant a local containment procedure.
Okay, so those triggers have been thought about, basically.
Yeah, thank you. So what we've done and what we are doing on an ongoing basis is running scenario sessions week on week. So last week we ran some scenarios where it was an outbreak in the Mermaid Pub, for instance, or an outbreak in a B&B. Next week we're running a session all the way through the end of evacuations, and we'll run different scenarios around the evacuation procedures. For instance, as someone said, whether the skipper determines that it's a boat in evac or not, for instance. So we are running scenarios constantly, testing our assumptions, testing any gaps in the system, and then testing those back with Public Health England and our other colleagues to make sure that anything we're picking up or we have questions on, that we're getting clarifications on. So while we're not running lots of this in real life, we're running those scenarios with our partners across the system to make sure that we're picking up on any issues.
Good. Okay, well, that's good. Yeah, it's good to get voices from outside the organisation, just to make sure that you're not in, there's too much confirmation bias in there as well. So that's good. Another question I had was, there seems to me there's two camps of thought there. So either we keep people on island, isolated in their accommodation, or we try to move them off. Paul, you mentioned in your introduction about not going down that route of keeping people where they are. Can you expand on the reasons behind why that wasn't a decision that was carried through?
Do you mean in terms of isolating within the accommodations being our default?
Exactly, yeah.
Yeah. Well, that was in consultation with the Islands Partnership and the business community at that time, and colleagues might want to come in, particularly to business colleagues, about the knock-on implications of that. I think Amy referred to earlier the issue about refunds, etc. How would that work? And therefore, this was felt, in effect, probably the most appropriate intervention that we could make at that time. Also, in terms of finding alternative accommodation, if that was the right thing to do, is not as straightforward as you might think either. And we have made some of those inquiries, but that's not been straightforward either, and Nicola's probably got some more detail on that.
Okay, and I think the starting point for us would have been, is it safe to keep people on the island? And the discussions we started with the business community is, was that possible? How would that work? What levels of capacity would we have on the island? And early days, even before the full details were announced, it became apparent that the accommodation providers' buckets were fairly high. So those accommodation providers that were open were starting to look at bookings of 70, 80%, and the capacity issue was very much at the forefront of our thinking. Government advice also came in to say if it's reasonably practical, people should go home. And I think that was the balance of the discussion at the time, is what's the best option? And I think in reality, we'll get a bit of both here. I think we will have some people that won't be able to travel and will need to stay on island, and we'll have some people who can evacuate. We don't know what the scale is going to be yet, and as Whitney says, if it scales up massively, Public Health England will take over anyway. So I think we will try and find the right solution for each and every individual, but that's not to say we haven't. There is a bit of both here. I don't think we're saying absolutely everybody will be evacuated, but we are aware of the accommodation providers' capacity to provide accommodation if someone is isolating for a fortnight in what is going to be a very busy season.
Okay. Okay, fine. And just like a final point to the business community as well, I think it's really important that accommodation providers explain to visitors that they should not be coming down if they can't make their own way down. I think that is a vital point. I think it's probably irresponsible and unfair on our partners on the mainland if we suddenly dump COVID positive or suspected COVID patients in Penzance and expect them to deal with it. So I think that's a call that should go out so that all the business community, if they're accepting bookings, please reiterate the importance of people having their own private transport into Penzance or Newquay. That's it from me, Chairman.
Thank you. Amy, would you like to make a comment on that from the business side of it?
You're muted, Amy.
Amy, are you muted?
Yes, I think I'm there now. Sorry, I do completely agree. We can advise as much as we like, though, and in the nicest possible way when not, people don't necessarily accept our advice. So there's always going to be some instances, perhaps, where, it's not possible to do so. On every booking, I've got a whole web page, on my website saying what's happening at the moment, advice on what to do. Don't travel if you're feeling ill. Travel by private transport if you can. But, there's only so much we can do.
Okay, thank you. Thank you, Amy.
Thank you.
Councillor Nellam. Councillor Nellam.
Yeah, thank you. Just unmuting. I'm completely torn here between a huge amount of work done by the officers and public health and all that sort of thing, but I very much take one of the points that Dr. Pickin makes, that I'm really, really torn between moving people, but there's obviously, we've had the conversation, are we doing it through the business sort of bent economy, are we doing it for health? Dan Marcus just made the question as well about, evac or stay. And we don't know until it happens how big it will get. I mean, it's a really difficult question, right down the middle in both ways, that I'd like to see the plan go ahead because it seems to make sense. But as Dan just said, when we dump sort of various people back on the mainland, Cornwall aren't going to be very pleased. And how do they get home? What condition are they going to be in? And I've just got a question in terms of the boat as well. If I was a COVID sort of passenger on a jet boat, the skipper's inside, and as a passenger, I'd be sat outside on a sort of 30-mile trip in the freezing cold, usually, grey and so forth. I'm not sure that I feel that comfortable sort of thrashing about on the ocean on an open-top boat, if indeed it was an open-top boat. But the jet boats are inside and out. And I don't want to squash the plan at all, but I just see both sides, and I'm really right down the middle at the moment. Everything's been laid out beautifully by all the different people about what we should do and how we should do it, but I really don't feel that comfortable with some of the plans.
Nicola, would you like to answer Mike's questions on that?
Whitney's got her hands up.
Carrie's got her hands up.
Oh, sorry.
Thank you, Chairman. Thank you. I just wanted to respond about possible or confirmed cases getting dumped on the mainland, because it would be on my doorstep and they're my responsibility as well. In my best interests, I want to make sure that that doesn't happen. And we have spoken with our colleagues here on the mainland, as well as the Scillies, to make sure that that doesn't happen. And we're really clear, if we can't be assured that a positive patient has appropriate onward transport, we won't evacuate them. We will find a way to keep them and isolate them on the island. Because we can't have people deciding, well, we got ejected from Scillies, we'll just stay and finish out our holidays on the mainland and spread it around. So we have taken that into consideration.
Okay, well, yeah, I mean, I see the answers in both directions, and there's no easy way on this, is there, really? But thank you, Chair, that's it.
Thank you. Councillor Smith.
Thanks, Chairman. Yes, echo actually some of Councillor Marcus and Councillor Nellam's concerns there. I think it's a very, very tricky one. Firstly, I just had a question around the details of if somebody's evacuated either by boat or by helicopter. What is the level of PPE for the skippers and the air crew to ensure they don't get infected, and then indeed the clean down procedures after a suspected COVID patient's been transported to the mainland?
Whitney, would you like to answer that question?
I will do. Thank you, Chairman. So we've gone through this extensively with our transport colleagues in their risk assessment. So to give you an idea, there's more than what I'll remember to say right now, but we've got to remember that in the hierarchy of controls of this disease, PPE is the last bit. We want to make sure that we're controlling it by providing distance and making sure that physically people are not close enough to each other to be able to spread it. So that's the first thing to make sure. So boat or helicopter, they will be at a distance where they won't be able to come in contact, close enough contact to transmit the virus to the staff or the crew. Okay? And in the helicopter, for example, there's sealed plexiglass between the passengers and the crew. And that's one of the main points that Public Health England wanted to make sure that we assured them of, is that that would be sealed so that there is no transmission between. In addition to mitigations such as that, they will be wearing PPE. So they'll have overalls, they'll have fluid-resistant masks, they'll have gloves, in addition to all the other sort of hand hygiene, distancing, etc. The crew will not be handling anyone's luggage or belongings. They'll have the passengers hand sanitize and keep a distance as they're boarding anyway. And we're making sure that the staff and crew are all trained to be able to use that PPE appropriately, because we're really clear, PPE is no good if you don't know how to use it. You're more likely to infect yourself if you don't use it appropriately. So being able to put it on, take it off, and dispose of it appropriately. All of our transport colleagues have in place cleaning protocols based on non-clinical settings or settings that have been in touch with positive cases. So there's an entire document that's produced by Public Health England for that. And in their risk assessments, they have detailed their deep cleaning procedures after every single transport or evacuation. So we're assured that that's in place. Did I cover all of it? Sorry.
Yeah, and just the distancing on boats then?
Yeah, and they've been able to identify where on the boats that passengers will sit in relation to the rest of the crew. So keeping that distance. As I forget which of our councillors said something about being outside in the cold. That might be the case. It will depend on how many are in the party. So again, it comes down to that individual assessment of the transport procedures to ensure that we're maintaining that distance as much as possible based on how many and who would be transported. But that is one of the considerations that we take into account.
Yeah, well, I can see that certainly on a jet boat that might have to be the case, and I would be just slightly concerned that somebody who's already feeling unwell and then outside for 2 hours on a boat may not be the best plan for them.
Yeah, and we'll take that into consideration with them. We'll have those discussions with those people to make sure that they're comfortable with that decision. Again, nobody's getting, I'm really clear, I'm not saying go, unless everyone is comfortable with the plan in place and that they understand what they're being asked to do. And that would mean understanding you might be sitting outside being cold for a couple of hours.
Okay, thank you. And whilst you're on, Winnie, if I can just clarify, I think you said in your piece before that Public Health England will be overseeing individuals' welfare en route. So just to clarify, is that from accommodation on Scilly right through to them getting home?
Yes, so Public Health England, and the second that we have a possible case, so anyone with symptoms, and then they request a test, Public Health England are informed, and they are involved in the process right from that start. So if we get to the point where we've got a positive case of a guest, and we're now considering evacuation procedures, that's a conversation between our outbreak team and Public Health England to determine what the best course of action is.
Thank you. And I wondered, Chairman, whether I could ask Dr. Picking whether that helps to alleviate some of his concerns around that care of patients from accommodation through to home.
Thank you, Councillor Smith. I was actually had my hand up to come in, and that's perfect timing. Frankly, no. If there is a medical reason to transport patients off these islands, that is entirely within an NHS assured route to do. That's exactly what we exist for. That's exactly what all our staff are trained for. And even amongst our own staff, if you look at healthcare professionals across the NHS, you know, it has been that group of individuals that have been most at risk of a lethal disease, and this is what we are talking about here. So, I agree with Public Health Cornwall on one very, very key aspect, which is that PPE, personal protective equipment, is the very lowest level of protection available. We help eliminate this problem, which is our top level. Our next level down is to avoid this problem, and this whole problem is utterly avoidable by not doing this process in the first place. Not removing people from a accommodation where they are safe, where they have heat, light, water, electric, where if they become more poorly, they have access to medical care. That is how we avoid this problem, not reliance on PPE.
Can I suggest, Chairman, that Dr. That she replies to that. I have to say that perhaps if Dr. Pickin, you decide that Dr. Pickin is to be asked any questions, then or intervene, as he's not a member of this committee or accountable to this committee, then that should not be during this stage of the process, because this is a member decision process where members are going with their questions to the medical officers and to the chief exec, who are accountable to this committee. Thank you.
It was agreed actually by members that Dr. Pickin could speak and answer questions.
I agree, Chairman, but there's a time and a place to do it, and during the member debate is not that time and place, because Dr. Pickin is not a member of this committee. So Dr. Curry could kindly respond and then move on to the other members of the committee, please.
Sure. I think some of... Oh, sorry, Chairman.
Yes,
sorry,
yes, would you like to come in there, Whitney?
Yes, thank you, Chairman. Apologies. I think one of the things that has been discussed previously, and colleagues do correct me if I'm wrong, is the model of care on the islands and the concern that patients staying on the islands were going to overwhelm the health services. And I think that's a real concern. Even up to today, I've been... that concern has been raised around how the health system on the islands is going to cope with additional people with COVID-19 staying on the islands and being able to be seen. So I think the idea is that if we can accommodate people who are well enough to travel, which is what the government is asking and is very explicit in their guidance in saying, if you're well enough to travel, get home, not on public transportation, which is what we're doing. And so we're following that guidance, and we're also protecting the very fragile health system on the islands by removing those people who would potentially be taking up a lot of our services on the island. I think we're doing a really great service both for the residents who need that health care, supporting that model of care, and to the guests, because we want to make sure we're offering a good experience. They're not going to be stuck being miserable in a place that's not their home. They can be well enough to be transported, get home to their own surroundings, and be able to get well at home and access their health system, their health care, and their own GPs. I know that's a lot of the discussion that's been going on for quite some time, and this is one of the ways that our colleagues have been hoping to be able to solve that very, very practical issue around fragility of the healthcare system.
Thank you for that. Councillor Smith, have you any other questions?
Sorry, Chairman. If I can just pick up on point number 12 of the evacuation plan, so page 13. The point in bold there about there's some types of accommodation where self-isolation would not be possible, and therefore guests should make their arrangements to travel home as safely as possible whilst minimising risk to others. This I don't quite understand. So presumably this is referring to if somebody is required to self-isolate, well, they can't just travel home safely as possible. They either have to stay there or be evacuated, surely. Or am I misreading this? I'm not quite sure. So page 13, and it's point 12, and the paragraph in bold there. Does anybody have anything to say on that?
I'm not. Would it help if I read out the paragraph? Whitney, you've got your hand up, but you're muted.
Is it okay for me to come in, Chairman? Yes. Okay, thank you. So I've got the passage now. So it's under the exceptions, yes? So there's some types, yeah. So I'll read it aloud for people who couldn't find it difficult to find it because it took me a moment. There will be some types of accommodation where self-isolation would not be possible. For example, where there are shared washing facilities, or if the risk to the host owner or staff cannot be mitigated. In these cases, guests should make arrangements to travel home as safely as possible, minimizing risk to others. So that's a passage from the government guidance. So that is one of the exceptions that they do explicitly say. Rather than saying lockdown, stay, isolate where you are, those are some specific cases where it makes the most sense for you not to stay where you are and get home as safely as possible. And even in those cases, they don't stipulate that it can't be public transportation. I wouldn't be sending anyone on public transportation anyway. But it's simply giving us a bit of guidance around some examples where you would want someone to definitely go home, if at all possible, to do safely. And I'm so sorry, was there a second part to that question?
Well, really, just to clarify that surely that could not happen in the Isles of Scilly context by simply going home on the boat or the plane or the helicopter.
Yeah.
On the normal public service, it would have to be by the evacuation service, wouldn't it?
That's exactly right. So the government has put these exceptions in, but doesn't necessarily account for the unique situations of some locations, such as the Isles of Scilly. Yeah. So they say get home if you safely can. And what this evacuation plan and the outbreak plan does really is give an option, give a safe option to be able to do that. And as I say, it's not every case where that is the safe option, but for those for which the risk assessment says yes, it is a safe option, we can have that available.
Okay, thank you. Going back to a point that Councillor Sims made around the clarity of the advice to accommodation providers and to visitors around the circumstances in which they may need to be evacuated, or indeed how they get home if they come by public transport, or indeed whether they might actually have to stay in their accommodation. I do think that needs to be made more clear. It's probably not clear enough. I don't think it hurts just reiterating, because until every accommodation provider knows that, we just need to keep getting that message out there. It's really important. And just something that Councillor Marcus says in terms of people not coming by public transport to Penzance, I'd sort of slightly tailor that and say, at the very least, if they do, they must have a plan B to be able to get back home by private transport if they are evacuated. So whatever mechanism that might be, by car, for instance. I just want to clarify with the monitoring officer on this actual report. We're not exactly being asked to sign this off per se, are we?
No, you don't have the terms of reference to do that. The Scrutiny Committee has no executive powers in this matter. What you are asked to do is to note it. I have to say, probably outwith the competence of the members of the Scrutiny Committee to actually challenge any of the scientific evidence, but you are to, obviously, to understand it and to raise any points that then can be considered in the event of there being any revision of the protocol. It's something that you're asked to note and raise any comments on.
Thank you, that's clear. Just one point I want to make on paragraph 20, confidentiality. I agree with it. I just sort of point out that there's a small group of islands where everyone knows everyone, and confidentiality breaches are highly likely. Therefore, I think particularly as members, but also anyone involved in this, must make clear that if anybody does get the virus, it's not fault. Apportioning blame is not going to be helpful to anybody, and victimisation is the last thing that we want. So I sort of really want to make sure that happens. And I think the final point I wanted to make, Chairman, was just around the walking from off-island accommodation to quays. I would personally agree with Dr. Pickin that I think this is the weakest part of this plan. He raises that as a serious issue. I don't, as I'm actually the point of contact for St Martin's, I don't feel all that comfortable that there are enough controls in place over who's enforcing how that person is getting from their accommodation to the quay, with absolutely minimising the spread of potential infection. I personally don't feel that's quite in place, and I think that needs strengthening. Does anyone want to pick up on that, please?
Avril, you're muted.
Sorry. Would you like to come in on that one, Whitney?
Yeah, absolutely. Thank you. Sure. Thank you, Chairman. And I think it does come, I know I sound like a broken record. It does come down to risk assessing that situation. So I'm not sure who said it earlier, that there's a consideration that the fewer people involved in evacuating a positive case, the better. So you reduce the risk of spreading it to anyone. So if we could reasonably get someone from an accommodation to the evacuation point, and it was by walking, and it was reasonable, safe, kept their distance. We have to remember, this bug doesn't come after you. You get in the way of this bug. Or you cough in someone's face to spread it, or you touch something and put it in your mouth, that kind of thing. So we've got to remember that we know a lot more about this than we did previously, and so we use that knowledge to make sure that we're keeping our distance. Anyone who would be considered for walking to an evacuation point would be given appropriate instructions about distancing. It wouldn't be at busy times for sure, and if we couldn't ensure that, we wouldn't do it anyway. They would be provided with PPE, so there are what we're calling go bags full of PPE with instructions, videos. I'm happy to talk through it with someone on the phone about how to appropriately wear their PPE. So they'll have fluid-resistant masks. They will make sure that they're wearing appropriately. So the risk in terms of getting that person from point A to point B is as minimal as it could possibly be. And if we're not comfortable with it being low enough, we wouldn't do it anyway. We would make sure that we found an alternative way of doing that. You're absolutely right. Yeah. It feels as though it's very uncomfortable because it's an uncertain situation when you're asking someone to walk through the public. But if I'm quite blunt, it's exactly what the government is asking everyone in the country to do. get from wherever you are when you've determined your positive case, get in your car and get home. And more often than not, that's going to be by walking to your car in the public. And they're not going to have PPE, but our people will.
Yeah, thank you. And actually, those grab bags I do have at home as point of contact. That's all set up. Chairman, you'd be very glad to know that's the end of my questions.
Thank you, Councillor Smith. Councillor Watt, please. Councillor Watt?
Sorry,
Steve,
unmuted. Can you hear me now?
Yes, we can hear you.
Jolly good. I was about to say, in fact, I've already said it, but you didn't hear it. One of the disadvantages with coming in late in the discussion is that nearly every point I was going to make is actually being covered. However, two issues, or as Dan Martin said, two camps of thought on evacuation or staying in the accommodation. One of the points was covered by Whitney when she said about the limited island health resources. But secondly, I think the advice in the Cornwall document, Keeping Safe Together, is very good, about visitors will recover better at home. Now, I don't necessarily think that's a question about recovery in a medical sense, but certainly as a social and their quality of life sense. In that case, it could well speed recovery. So, as I said at the beginning, most of the points I was going to make have actually already been covered, so there's no point in going over and over it all again. Thank you, Chairman.
Sorry, who would you like to answer your question?
It wasn't actually a question, it was really a point
you're
about
just making a statement.
The two issues about either leaving or stay or leave, you know, a bit like the old rock and roll song. Should I stay or should I leave?
Well, I think we've probably covered that in the answers already, haven't we? Have you any other questions, or Councillor Watt?
No, that's fine, Chairman. They've all been pretty well covered.
Thank you very much. Councillor Williams, welcome.
Thank you, Chairman. What a way to start my Scrutiny Committee career.
Well, I thought you might enjoy it.
I think members are absolutely between a rock and a hard place, aren't we? We've got two very differing points of view from two very experienced schools of thought, very highly trained, experienced professionals. And here am I with my 2-day paediatric first aid trying to make an informed comment. In an ideal world, we would love the island to be locked down and full government compensation to be given to us so that we can carry on surviving and thriving just without the people. But that isn't going to happen. The Prime Minister has said people can go on holiday, and furthermore, he's now putting in place VAT and eating out incentives to actively encourage people to come on holiday, and especially over to Scilly. So I think we do need to have something in place which allows us to cope with the influx of people and potentially the influx of virus. I recognise the efforts that everyone has gone into to create the documents we're looking at today. But I'm also mindful that if we look at guidance and all the different publications, we can almost always find something which contradicts something else. So basing our decision on just one document is always a dangerous position to explore. I'm mindful of what Paul said in his introduction, that we're never going to find the perfect plan to navigate this complex situation, but I feel that what we've got before us today is probably as good as we're going to get, but also taking on board the comments that it's a dynamic document and it's going to evolve and be reviewed, and I'm pleased to hear about the scenarios which have been developed to continue to test it. One thing which hasn't been mentioned in the discussion so far is the enhanced testing, which the Council has been leading on, and I think that's something which we should be pleased with. I've actually seen it out and about being undertaken, so I think we should have a bit of confidence in that process. But I think, having listened intently to the discussion, taken on board all the different comments, and again, being mindful of the recommendation that all we have to do today is note the plan. On balance, I support the conversations which have been had this afternoon, and as much as I hope the plan isn't required, I think we're in a good place to at least have it in place. Although I do echo the comments that Amy made at the start about it needing extensive promotion, perhaps the engagement board can be part of that to make sure everyone is aware of what to do and how to do it. But I don't have a specific comment or question to make 21, Chairman.
Thank you, Councillor Williams. Well, now it comes to me.
Chairman. Sorry, Chairman. We do have our co-opted member of the committee as well in Halford Charleston.
Yes, sorry. I'm sorry, Paul. Paul, would you like to make any comments?
The only thing I would say is I've been involved in different situations, but the similarities have been with regard to emergency responses, emergency response planning over a few years ago. Now, I have to say, and I would, with all the parts that haven't quite fit the jigsaw of trying to put a response to this virus, which is hopefully not going to affect us, but if it does, I think, as I said, that there might be one or two parts of the jigsaw that don't fit, but I'm really quite impressed at the level of working together that is achieved. Certainly it's feedback from my coordinators or from our coordinators, but the planning and response has been really, really good. And I think we should see the positives of it, and the staff and contributors should be recognised for what they've arranged. No more to say.
Thank you very much, Paul. I actually haven't got anything to add, but I think Councillor Sims wishes to say something.
It's a question for Public Health Director Whitney. This is the evacuation plan addresses the tail end of this, really. I think I've read this, I know the answer to this already, but I think it might be useful to get, if people who are listening in got some reassurance regarding the track and trace, because as soon as somebody comes forward, then the track and trace of what they've been doing previously has to come in, because they could obviously have been spreading the thing for 3, 4, 5 days prior to the symptoms turning up. So I just wanted you perhaps give people some assurance about what we're doing regarding the prior contact.
Sure. It relates a bit to our comms that we've been speaking about, and hopefully you'll see more and more, lots and lots of communications coming out about test and trace. So you've got a local enhanced testing service for the Isle of Scilly. So the message is out there as much as we can, and we'll keep blasting it out. Anyone who's got symptoms needs to immediately isolate and order a test. And we're doing that through the Devon service. So you call the number or you go online and you order your test. And are we calling her an operative still? It sounds very, very MI6, but she is our mobile testing operative. On St. Mary's, for example, can go out, do a swab in the morning. That sample gets sent back to the mainland to be tested that evening, and we get results the next day, depending on weather as much as possible. But generally speaking, it's a very, very quick service. It's almost faster than what we've got on the mainland in many respects. Mobile testing coordinator Tanya has told me. On the off-islands, we have that system as well. So we've got mobile testing kits for people to be able to self-sample. And I'll tell you, I have a 5-year-old. She self-sampled herself yesterday. We got the results today. They were negative, thank goodness. But even a 5-year-old can do it. So I'm quite confident that getting those self-sampling tests out to the off-islands is a really good way to go. And we did one the other day. It was really fast. Turnaround time was great. Get it out. We haven't had a positive case yet, but the way that the service works is that positive test result comes back to us as the outbreak team. It also goes to the track and trace system. So there's two levels of catching your contacts. Us as an outbreak team, we're able to support locally to understand where that person has been, who they might have bumped into in the islands. Did they pop into the co-op? Did they go out to the Mermaid the night before? And start getting an idea of where we might need to be picking up contacts. At the same time, the track and trace system gets in touch with that positive case and they effectively have quite a long interview with someone. It can take about 45 minutes to understand where they've been, who they've seen, what they've done, and that's for residents, non-residents alike. So everybody gets that depth of an interview to understand their contacts. And then anyone who is determined to be a close contact, I need to be really clear. It's not just anyone who's been within a half a mile of you. It's a close contact, and that can be face-to-face for any amount of time, or within 2 meters for more than 15 minutes. So we've got to be really clear what a close contact means. So just because someone's been out and about in the community does not mean they've infected everyone. And it's the other reason we just make sure that all our businesses are COVID secure. We're keeping people at a distance. We've got mitigations in place. That's meant to be so that if you do have someone as a positive case in your establishment, because you're working to COVID-safe guidelines, you're a much lower risk of becoming a contact because you've got those mitigations in place. But the track and trace service will pick up those contacts, get in touch with them, and advise them if they need to be self-isolating. So effectively, in terms of communications with your residents and guests, no news is good news, because we'll come after you in the best possible way. We'll come and find you if you're a close contact, and that's the idea of how it works. Is that okay? I know that it's a lot, kind of one summary.
That was exactly what I wanted to hear. I did know that already, but other people should be useful for people to hear it. Thank you.
Yes, thank you very much. Is there anything else you would like to say, Whitney, on this subject before we take the recommendation?
Briefly, thank you, Chairman. It sounded a bit like Dr. Picken and I were mortal enemies, and it's nice to recognize that actually we're working together, and not just on this, but lots of things like flu planning, and we challenge each other, we challenge the plan, and it's really good to have that challenge from colleagues and that feedback, and so that I hope will continue, and we do take on feedback and bring it on board, and we have good conversations and good planning sessions. So I appreciate that input.
Yes, I think that's very important to keep that relationship because there are a lot of people that are worried about the infection side of it. And as Dr. Pickens says, it's always been you don't move infection. You leave it where it is and look after it there. But these are extraordinary circumstances. I do recognise that. Thank you.
Afro, may I just ask one last question?
Yes, Councillor Lane.
The signatures required on page 19 of the form, ultimately the sign-off that someone is fit to travel. I assume it would be all three would be required. And it would go in that order. I was just then a little confused why only one is needed for not being safe to travel. It just seems counterintuitive. So presumably, if there is not a signature in one of those three boxes, then that's the same equivalent to one in the next box. The or. I don't know who's the appropriate person there. Whitney, if you want to come in.
You make a really good point there, actually. So, let me take that feedback on board, and we can absolutely update that form. I take that point that if we don't have all three signatures, it's not going ahead anyway. So you're absolutely right.
Thank you. I'd also like to echo Whitney's last comments there about, we aren't necessarily enemies. We disagree and we challenge each other, and that is the entire purpose of the Scrutiny Committee, is to actually bring any plan of the councils to be its best. That's why we're asking these questions. It's not to try and stop anything, it's to ensure that it is the best it can be. And I think this has been an excellent example of us all working together and everyone talking to each other to push it to be the best it really can.
Thank you, Councillor Lake. Yes, before we take the recommendation, I'd like to thank Whitney for coming and taking part, and I'd like to thank Dr. Picken for taking part and our officers in this discussion. I think it's been a good discussion. I think there are quite a few points that have been made that require further consideration, especially with the transportation of potentially infected people. Perhaps you can take that back. But now I would like to take the recommendation. Could I have a proposal, please, that members note the attached evacuation plan protocol and associated appendices and ask any questions that aid their understanding? Could I have a proposal, please?
Propose that.
Well, I'll second it. I'd also like to make a further recommendation there.
Right. Councillor Sims would like to make a further recommendation.
Given that it's been raised by at least three of us, just that there should be more emphasis given to the fact that visitors without public transport may well have issues in the FAQ, because it's mentioned 10, 20 times in the wider outbreak plan, but it's only given a little bullet point in the FAQ, and I think it should be at least in bold, preferably in red, so that they can't say they've not seen it, because it's going to be a big issue for them.
Is there any precise wording, Councillor Sims, that you're thinking of?
Well, essentially, I think I've just...
Chairman, I think it might have been done, Chairman. I think maybe just ask Tanya. I think that was updated earlier today and put in red bold. Let's just double check that with Tanya, if that's okay with you, Chairman. I think it may already be covered.
Well, that's all I want, really, just so people definitely will see it.
Hi there. Hi there, it's Tanya. Just to confirm, there is a new web page on the Council's website that's been updated today with additional documents and taken on board your comments from last week, which includes that update, Steve, and it is highlighted in a red box.
Okay, great. I was hoping you'll be on video then. I've not actually seen you yet. You've been in place for 2.5, 3 months. Thank you very much for that. That's great. Oh, there you are. So now I know what you look like. Okay, thank you.
Thank you. Right, we have a proposer, Councillor Marcus, for the recommendation, and we have a seconder, Councillor Sims. All those in favour? I'll take that as consent. Thank you very much.
Just check, Chairman, are there any against?
Are there any against?
Thank you, Chairman.
No. Thank you. No, I've lost my agenda now. Health watch, isn't it? We go to the next. Where is it? Agenda is it number what? Right, we're now going to agenda number 5, the Health Watch paper, please, which is going to be presented to you by Bob Dawson, or is it going to be Paul, Bob? Bob?
Yes, Chairman. I just provide a very short covering report for these external papers. I'll take my covering report as read, and I'm very glad to hand over to Paul to describe the activity that Health Watch Isles of Scilly has been carrying out in recent months. Thank you.
Paul, would you like to come in?
Okay.
Very much welcome, by the way. You weren't here at the beginning of the meeting, so I do welcome you now.
Yes, you did welcome me, actually.
I did.
Yes, you did, yes. Well, like many other agencies, organisations, we've been a little disrupted in our usual practices and workload. But fairly early on when this virus decided to raise its head, it became clear that some people on the island may not be able to get about or to do things that they would normally be able to do, or do things that they're not able to do any longer because of ageing or disability or isolation, etc. So Adult Care approached us, and we were of the same mind that it would be beneficial, perhaps, to have some volunteers from the community who are able to do fairly straightforward tasks, maybe collecting a prescription, a newspaper, shopping, or just having someone as a contact to say hello and how are you doing. So basically, we've had up to we had just over 30 volunteers originally. We've lost some recently because of the opening up of the holiday accommodation. So we're now down to about 20 volunteers who offer an hour, maybe a couple of hours, or maybe more a week in doing sort of straightforward tasks, which the response has been very, very positive to what they've been doing. We have 36 people on our list, and we add to that each of the persons on our list gets a telephone contact from our staff, Karen and Catherine, per week or as arranged or as needed, just to check up on how people are. And we do feel that whilst this is a really good community, it's a small community, and there's lots of support there, neighbourly support, etc. But there are still people who may be vulnerable, lonely, isolated. Some may be developing mental health problems. There are a whole load of issues that affect people who are the people who don't normally raise an issue, and sometimes people that we overlook by accident. So the contacts are made with the volunteer, or the introduction is made by telephone call. The volunteer will contact the recipient, the person who may need some sort of help, and they will make their arrangements to either undertake a task of some kind or to fetch and carry maybe, or whatever the need might be. So this we don't. It takes up a fair amount of our time, but I suppose some of that time is made up by the fact that we aren't doing all the things that we normally do anyway, because of prohibition of being able to meet with people, etc. So that's what we do. It's very positive. It looks as if, unfortunately, it looks as if it will go on for possibly some time, because I hopefully it doesn't deteriorate. But that's what we do. It's a sort of good neighbour arrangement, and it works really well. No more to say on that at the moment.
Right, thank you, Paul. Yes, I do commend Healthwatch for all the work they've done. My husband is vulnerable and gets his phone call every week, which he thoroughly looks forward to, only because I think it's a female voice at the other end. So, anyway.
I will ring him in English.
And please do congratulate your two girls, Karen and Catherine. They've really done a good job. I was just glancing through your work plan, which there was just one point in it I wanted to bring up, because it needs to be, and this is, we did come to an arrangement, I believe, where X-rays were going to change in October to Thursdays, and I think they did agree that, Paul.
Yeah.
I think that's something that could start to be chased up now, because it won't be long before it's October, unless, of course, the coronavirus thing has it changes everything, but we did try to get it onto a Thursday when it was shopping day for the off islands.
I will do that.
Yeah, okay, thank you.
That's good.
I just go through the councillors in case anybody's got any questions for you, Paul. Councillor Sims.
Just thank you, Paul. Well done. I mean, it's come at the hour, come at Health Watch. It's been brilliant. Thank you.
Thank you. Councillor Legg.
Thank you, Chair. I sit on the Medical Travel and Transport Group with Health Watch, and I was just wondering whether Health Watch were speaking with partners about resuming it. There are still people who need to go away for medical reasons, and I think it would be good to pick up the work of that group again.
Yes. In terms of sort of multi-agency discussions, I've heard what you've said on that. What I would say, though, is that we have conducted 3 mini surveys, one about mental health, one about transport and medical issues over recent time. We haven't had great responses, granular responses, but we have had responses upon which we've acted upon. For example, at one point, for very good reasons, commercial reasons and for practical reasons, I believe somehow the Skybus was offering people medical appointments for 2 weeks in advance. And we have some feedback saying, well, we want to make arrangements, but we have to make arrangements for more than 2 weeks in advance. And I believe we contacted Skybus and the Truro Hospital, the Royal Cornwall Hospital travel section, and within hours it was altered to people being able to make it in 4 weeks in advance. So the connection, the relationship, the liaison, that's still working and very positive. But I did take a point about maybe everybody going through the experience of a virtual meeting of some kind and trying to pick up on what we've not been able to get around to doing so far. Okay.
Yes, thank you. Thank you again for all of the work that you do at Health Watch. Like as has been mentioned, you've really picked up the baton at the minute and demonstrated the important work that you do, and I hope that it's not missed by any on the council.
Thank you, Councillor Legg. Councillor Marcus.
Thanks, Chairman. Yeah, thanks, Paul, for reading this. It's a nice insight into a pre-COVID world, really. We weren't so worried about pandemics and everything. And it's really good that you guys have stepped up and integrated yourself really well into the response. It's been an integral part of the response, I think, on the island, and that's been really helpful. What do you think the organisation has learned from your response, and how do you think you're going to take that on in the future?
To be honest, I would have to give some thought to that. But I would say that I think we've learned that it would be of some benefit for the future when COVID is reduced to something which is maybe more manageable, because I think it's difficult at the present moment with many restrictions that we have, to have a scheme of some kind that maintains level of contact with the hard-to-reach members of the community, if I can put it like that. And we're certainly not averse to actually thinking about that a little bit more. And there are sort of very early discussions about a model, but nothing has been decided. But something of that kind might be beneficial. That is certainly one thing that we've learned. and I'm very conscious of because of my previous experiences of how vulnerable and lonely and isolated some people can be. It's surprising when you lift the corner of the carpet to see what's underneath it.
Yeah. Brilliant. Thank you very much.
Councillor Nellam. Councillor Nellam.
Just unmuting. It's not a question. I'd just like to thank Paul and his team very much. I've been one of these lucky, vulnerable people that have been looked after by HealthWatch since March, and I can't thank them enough for the level of sort of contact that they've made. And if they've done the same with everybody else, which I'm sure they have, then I'm delighted in the work that you've done and the support you've given everybody, and especially myself. So thank you.
Thank you.
Thank you, Councillor Nellam. Councillor Smith.
Yeah, absolutely echo all the thanks, and very, very well done. Also, I should just like to, whilst we're on this subject, pay tribute to the off-island teams as well, because I think a lot of the off-island communities work in a very similar way of looking out for their own, and I think they've all stepped up very well. Just as Chairman, you picked up on my point actually I was going to make on the operations. The X-rays being moved to a Thursday. Just to confirm, Paul, in terms of that kind of deadline of the autumn, that's really when the issue kicked in for off-islands in terms of reduced boat services. So just wanted to sort of check that you're okay to try and get an answer sort of well before that time, please. Sorry, Paul. That was Paul Chandler.
This is about boats.
About the X-rays on a Thursday. Yeah.
It's about the X-rays.
Oh, the X-rays. Yes, we take that on board. Sometimes it's a long road that you have to travel. I would say that it's like very similar to us promoting over some period of time that perhaps more virtual consultations would be helpful to people on the island. And the benefits of lack of less travel and the benefits of savings in cost. It seems as if fortune is favouring us because it is now being, I think, looked at in a very positive manner. And I believe there are 2 members of staff from Trellis Hospital whose purpose in life is to promote that even more because of the size of Cornwall, but also because of our situation here.
And that actually was leading straight on to my next question, your point there about virtual consultation. So is that something that's happening much more routinely now?
Good question. I can't honestly say. I believe so, but I haven't come armed with an answer. I didn't know that was the question.
No, of course. I'm just very keen to understand it because, as you say, it makes a lot of sense where appropriate in terms of cutting costs. I mean, I'm interested in the carbon emissions, all that travel being cut, and it's often a lot more time efficient for patients, isn't it? So
certainly I've met with the one person who's responsible for a Truro, a nurse, who's a statutory nurse, and we have had some contact, and so we do have a relationship with those people. Truro.
Okay, well, keen to hear an update as and when. That'd be great.
Chairman, it's Paul here. And I was just to build on that point. It's just very, very timely that at the Health Senate this morning, the very point came up about virtual appointments and virtual diagnosis, etc. And health professionals were saying how much that has accelerated during the COVID period and how they want to not only embed it now, but accelerate it even further. So I think the answer is you'll see much more of it.
Thank you, Paul.
Seems very encouraging.
If I could come in and just suggest to Paul Charnock that when the Medical Travel and Transport Group resumes, someone with an overview of that from Trelisk is included on the group going ahead, so that there is always that virtual clinic aspect to the group.
Noted.
And my last point was, thank you, Chairman. Just my last question was just around just on dental services, I know at the start of the pandemic there was a restriction on dental services. Are they sort of, back to normal routine checkups and that sort of thing now? Do you know?
I believe I could be quoted on this, but I believe it's still essentially emergencies only, and there are I think that's a national issue rather than it's not a local one. We haven't. We've only. I only know of one situation that's been referred to as concerning a member of our community that was dealt with. I don't know any more than that in detail.
I don't have any specific concerns. It's just it would appear that the longer it goes on, as lack of routine checkups, the worse the problems could be stored up down the line.
The limitation on dentistry arrived about a week before I was due to have my checkup, and I've practiced it as well. There you go.
But yeah, be keen to understand the situation, and obviously I'm sure you'll keep an eye on it.
Okay.
Thank you, Chairman.
Yeah, Chairman, if I could just add about the dentistry aspects, as far as I'm aware, that is one of the services that's updated on the council website on the coronavirus daily update, so there may be some information there, and I think that's taken from the dentist as well. But I know it's an area that Healthwatch take very, very carefully. Thank you.
Thank you, Bob. Thank you, Councillor Smith. Councillor Watt, please.
Yeah, thank you, Chairman. Just to echo, thanks for Healthwatch, but I enjoyed just make a point, I enjoyed the April newsletter very much, and I may have missed it, but is that to be a quarterly publication?
Our newsletters are often, I would say that we used to be able to produce them maybe every 2 months or, say quarter. I think this COVID situation has actually overtaken us, and there's only so much. We just have 2 part-time members of staff, Catherine and Karen, who so when we get sufficient interesting items, then we will produce one as soon as we can. I mean, I would want to have a sports section on the back page, but I won't do that. It's as and when we can. Unfortunately.
Okay, thanks for that. Thank you, Chairman.
Thank you, Councillor. Thank you very much. Councillor Williams.
Thank you, Chairman. Again, on the principle that every crisis presents an opportunity, I hope that we can build on the platform, particularly around volunteering, which we've touched upon in the report today. Paul alluded to some conversations about the future, and I've had conversations too with council staff. And it won't be coming to Health and Wellbeing Board next week, but I'd very much like to think that the September meeting, we might be able to think about using Better Care funds to explore making that service more sustainable. And my only other point was I would hate for some of the outcomes which have been achieved by Healthwatch to be lost and forgotten. We've already touched upon personal experience in this meeting. I would very much like if Healthwatch can find time, can find the resource to be able to capture some of the difference they've made to individuals over the last few months, whether that's just buying somebody's shopping, whether it's being a friendly face at the end of handing over prescriptions, or just doing all those 101 jobs which volunteers have been doing. But I think there's a really, really good social story to tell. And I know that in the normal world, we sort of go from one pressurised environment to another, and it's often the case that things do get lost and forgotten. So I'd really like to encourage, again from a commissioning point of view, that we can find out exactly what difference Healthwatch has made, how it's done it, and how that's made people's lives bearable, perhaps even more significant than that over the past few weeks and months. Because I really do believe it probably has had a massive positive impact on people's mental health, and just staying in touch and staying in contact with what's going on. and I think it would be really useful to capture that.
Thank you. Yes. I mean, I don't know what today is going to be like, but it's been very positive. But I think that reflects on our staff, our two staff, Kathleen and Karen. And I have to say that the directors, we all make a little bit of a contribution, but they do the work. And I have to say, I was proud of them before. I'm even prouder now. Thank you.
Thank you, Paul.
And Chairman, if I could come in on that as well, I think, Health Watch are doing a fantastic job, and as the contract manager, what Councillor Williams has just described is captured under the grant agreement in terms of monitoring and reporting. So, we definitely want to make sure that these positive outcomes are not lost and forgotten. Praise is well earned there.
Yes, thank you, Bob. I agree with that. Right, recommendations. Could we have a proposer, please, that members welcome the recent activity of Health Watch Isles and Scilly and ask such questions as are required to improve their understanding? Proposer, please.
I'll propose it or second it or both.
Right. Proposed by Councillor Scott and seconded by Councillor Smith. All those in favour? Thank you. Anybody again? No. That's carried. Oh. Thank you very much, Paul, for attending. Thank you. Thank you. Right. Agenda item 6, General Data Protection Regulation. I think this is going to be presented by Stephen Taylor.
Yes, thank you, Chairman. And obviously, Simon Mansell gives his apologies, but is on leave this week. This is the annual report of on the General Data Protection Regulations, and so I'll assume that members have read the report. The key point really is that the assurance level that Simon is able to give is that it is moderate to good, as in paragraph 4, but it is conscious that some areas do require careful monitoring in order to raise the assurance to good level, and there's some ongoing work required. And perhaps one of the ongoing work required, which has been mentioned by Councillor Marcus previously, is the training position, which on paragraph 12, the general training level is target is 83%, which is issued by the Information Commissioner nationally. Our level is reported to the last upon performance statistics is about 57%, and our target's about 80%. So what we're saying is that there does need to be some concentration on training, but obviously in the last few months, like a number of other bodies, the training has been reduced for obvious reasons. So on the whole, it's a positive situation, and what Simon is recommending is that we devote some time to getting back up to speed, and that there be an update report in 6 months' time with a full report in the July meeting, which will be the usual annual report. Any questions? Welcome, Chairman.
Right, thank you. Councillor Sims, any questions?
Well, I love the report, and and I think it's a good idea to come back in January. I would like to add a third recommendation, which I don't think they can. But I realise that Tom Wilson is now our CSIRO, and I would like to make a recommendation that he holds CSIRO in all the circumstances. But I don't think it's appropriate. He's fighting Wolverine after work.
I would like to support that recommendation without Tom having the opportunity to say something on it.
I'll let it go then.
All right, thank you, Councillor Sims. Councillor Legg, any questions?
I welcome the report, and note that it's moderate to good, and
Yeah, let's do what we can to move up. So good.
Okay, thank you. Councillor Marcus?
Yeah, the only thing, like I mentioned to Bob and Stephen before, is training. I would expect that to be a lot better by the report next time. I think this is really, even though everyone's been busy, it's really important to embed those GDPR basics and fundamentals within the council workers, especially when they are sharing data across the organisation. And this training is always online, so there's no kind of there's no excuse for not doing it, really. So that's it. Thank you.
Thank you, Councillor Marcus. Councillor Smith?
Sure, if you don't want us to do Councillor Nellens first.
Oh, no, I beg your pardon, Councillor Nellens. Councillor Nellens?
Thanks, Chair. Nothing to add that hasn't already been said. Thank you.
Thank you. Councillor Smith?
We'll go again. Absolutely. Support very much what Councillor Marcus says. I think that's absolutely true. And just a question really around, have there been any serious data breaches that we know of?
No.
Well, that was reassuring.
I was say two short answer perhaps, but that's the position as I understand it.
It's the answer we all want to hear. Okay, well that's good. So otherwise, yes, support the paper.
Thank you. Councillor Watt?
Thank you, Chairman. Just a similar question to Jonathan's, actually, about paragraph 16, that the alarming amounts of money that have been fined by breaches in data protection. I wonder if are there any British councils that have been fined?
Yes, in my previous life I was the data protection officer and the SPIRO and various things. And there have been a number of fines to not only local councils but to local health authorities and indeed to the government as well. Which really goes back to Councillor Marcus's issue that providing that you have a training regime in place, then that is evidence to the Information Commissioner that you are treating it seriously. Often one of the aggregating factors for the level of fines is the lack of a proper training regime, which shows its importance really. But as is said in the report, the module is being reviewed, and the online e-learning is available at all times. But we do want to make sure that it's even better than it is.
Thank you, Stephen.
Thank you. Councillor Williams?
Nothing from me to add to any of the previous parts of the conversation, Chairman.
Right, thank you very much. The recommendations? Two recommendations. Members note the contents of the report, and that members request an update report to be brought back to the committee in January 2021, and a full report will be brought back to the committee at its meeting in July 2021. Could I have a proposer, please?
I'm happy with it.
Councillor Sims has proposed. Could I have a seconder?
I'll second that.
Councillor Mark. All those in favour? Anyone again? Consent. Thank you very much.
Thanks, Jen.
Agenda item 7, Member Code of Conduct, also presented by Stephen Taylor, our monitoring officer.
Thank you, Chairman. This is quite a chunky item, really. There's a lot in it. And what I've done in the report is to give the details of the Local Government Association's draft Model Code of Conduct upon which they are consulting, and the date of the consultation response is the 17th of August. But also I give the context of the background to the Model Code and why the Local Government Association has drafted one. And it all goes back to the Committee of Standards in Public Life report, which was published in January last year, which the Scrutiny Committee considered at the meeting in April last year. So there is a bit of background to it. And on page 4 of the report, paragraph 13, I set out the action which the Committee on Public Services recommended that did not require a statutory change, one of which is the production of a model code by Government Association, which is what's been done. And the other one is to do with the establishing a register of gifts and hospitality, which the Council already has in place. The model code has a lower standard of reporting, whereas the committee recommendation was £50. The model code is less than that, it's £25. And there was some debate last time as to whether or not the model code should include reference to gifts being refused, even if they weren't, so that they were offered but refused rather than accepted. So that is something that perhaps can be picked up in the response to the consultation. And then I go through the other recommendations in some detail in Table 2. And what I then go into is comments on the model code. And what the model code does, it slightly changes the emphasis on various things, and it introduces new concepts. For example, a new concept of civility. Not defined, but it just simply says that the specific obligation to commit to treating other councillors and members of the public with civility, and that seems to replace the obligation in the council's code to treat others with respect. So civility and respect, are they the same things? If they are, then why change it? If not, what's the difference between civility and respect? I think there's no problem in changing terms, but the issue then is, okay, so what exactly has changed, and is it something which members are happy with? And there are other matters which are set out in the report that I won't go into too much detail over, concerning declarations of interest and financial interest and well-being as well. So the key thing really for members is whether or not they wish to make comments now, make comments to me later, for me to consult with the chairman and vice chairman of the Scrutiny Committee in composing a response, or whether members want to set up a small panel to discuss it further. The recommendation is probably that the easiest way forward is to authorise me to respond in consultation with the chair and vice chairman, having regard to any comments received. But obviously, if members have burning issues, refer them now, or if a number of members want to take part in it, then set up a small panel, and we will meet either later this month or early August. Hope that sets out the position, Chairman. Obviously, happy to answer any questions.
Thank you. Yes. Before we discuss this, Mr. Lambert, are you there? Mr.
Yes,
Lambert?
I can hear you, Avril, yes.
Right, okay, thank you. Mr. Lambert is our independent person. We haven't called upon you actually very much, have we? Not at all, I don't think.
No, I think Silly has the most ethically robust councillors in the whole of the United Kingdom.
I just wondered if you would like to make any comments on this consultation.
Not really, because I haven't fully read that document. I focused on the annual reports and ethical standards regime report. But Stephen did suggest to me that he and I spoke next week about if I had more robust observations to feed into this consultation about the code of conduct and its review.
Okay. Yeah, that'd be fine. Lovely. I don't know what... would members be happy with emailing Stephen with any comments on this, and then for Stephen, the monitoring officer, to be in consultation with myself and the Vice Chairman to submit the committee's response to the Local Government Association. If I just go around you, if you're in favour of that, you can just tell me. Councillor Sims?
Yeah, broadly, but I do have a specific question to Stephen here. Table 2, item number 1, which is number 3, it's basically, it's regarding social media. Looks like if you put stuff on social media, then you can be considered being a councillor. Now, I put quite a lot of stuff on social media that I perhaps wouldn't have shown to my mother.
I think that is the debate, isn't it? Is everything which you put on social media with people knowing that you are a councillor, should that be subject to the code of conduct?
Yeah, well, that's somewhat of an issue because people don't necessarily have a personality transplant when they become a councillor, do they?
No, it's a question of how they express it, whether they express it with civility or whatever. But the point is, the model code really, I think, is trying to distinguish between members acting in their official capacity, where they are performing the official duties of their office, as opposed to the councillors being bound by the code if they tweet various comments, which may well be intemperate at times, and if so, are they going to get themselves into trouble because of that? And I think really we just need to know either way, so that councillors can behave accordingly. And if councillors have a view on that, it will be useful to know what that view is.
Okay. Councillor Legg, would you be happy with the arrangement to email? Any comments?
I would actually like a sort of a broader discussion on this. I think as it stands currently, I understood that, you know, as it states in point 4 in table 2, the local authorities code of conduct applies to a member when they claim to act or give the impression they are acting in their capacity as a member or as a representative of the local authority. That's the way I understand it, and that's how I work by. Changing that so that anything you put on social media ever would significantly impact my life and livelihood. I would add. So I think this needs broader discussion than just a few email comments.
Okay. So would you like to discuss it with us all, Stephen?
I'm going to say,
have a plan?
Well, what could be done would be that when you and I and Steve arrange to meet to discuss this and go through perhaps draft answers to the consultation, that we can notify all members of the Scrutiny Committee when that discussion is taking place, so that they can join us. So there's not an official plan. That would be the best way forward that I can take. Okay. Fine.
Okay. Councillor Marcus, would you be in agreement with that? I think Councillor Marcus might have left us for a little while. Councillor Nellum.
Yeah, thank you, Chair. I'm very happy with the arrangement that Stephen's just laid out.
Okay, thank you. Councillor Smith?
Yeah, thank you. I also have a number of comments and support Councillor Legg's proposal there.
Okay, yeah, lovely. Councillor Watt?
Yeah, thank you, Chairman. Broadly in agreement. Just a comment on gifts and hospitality. Just a story that several years ago when I was tourism officer, I turned down a free weekend at the Island, not the Island Hotel, sorry, the St Martin's Hotel. some years ago for my wife and I, and I turned it down, and the manager at the time felt insulted. So there's a fine line to go there. But yes, I would agree with that.
Okay, thank you very much. Councillor Williams.
Yeah, happy to support the view of put forward by Councillor Legg.
Right, lovely, thank you. Right, so
we'll arrange a date then. If members are agreeing to that, then we will arrange a date and invite Ben and then
anybody can come if they want.
Yeah.
Yeah. So, do we need to take the recommendations, or do we need to?
Well, the short answer is yes, but we'll slightly amend it so that the recommendation is that members authorise the monitoring officer in consultation with members of the committee to submit the committee's response to the Local Government Association. Okay?
Yeah.
So it widens it out. It doesn't create a separate subcommittee which then has to give notice and all the bureaucracy attached to that. But the response will be a public document, obviously.
I'm happy to propose that the wording that the monitoring officer just used.
Thank you. Could we have a seconder, please?
I'll second it.
Councillor Sim.
And obviously, Dr. Lambert will be invited, subject to our conversation with him next week.
All those in favour of the change recommendation? Anyone against? That's consent for that.
Thank you.
Thank you. Agenda item 8. Ethical Standards Annual Report.
Thanks, Sharon. The highlight of the committee, the highlight of the meeting, I'm sure, Chairman. What I've tried to do here is to obviously summarise what activities have taken place since the last annual report, and set out in some detail what has been done, and also, perhaps that's the most important part, is to review the future of ethical standards, which is paragraph 25 onwards. And so part of it we've obviously covered in terms of the reference to the Committee of Standards and Public Life. And then in paragraph 33, I set out suggestions for the ethical framework review over the next 12 months. Which will be obviously at some point the review of the Member Code of Conduct when the LGA Model Code is issued, and you may decide to accept some or none of it. You may be very happy with your code. The second part is the induction programme for newly elected members, assuming that there is an election in May 2021. We will have to do a programme for that. And also, there is reference in the report to refresher training, because that was one of the issues that was raised last time, which due to a variety of circumstances and availability and all the rest of it, we haven't perhaps done as much on that as perhaps we could have done. Then there's the reference to the independent persons and Dr. Lambert and how we could have better interaction and input from him in relation to ethical standards. And then there is a review of the general governance arrangements of the Council, which I've got no concerns over in terms of there is something which is really wrong. But nevertheless, it's something which the IDA has issued a kind of a desktop ethical audit, they call it, just to check that all the elements of the governance arrangements and ethical framework are in place. And I would suggest that I do one of those. It's something which I have done for many years now, and I think it has shown its worth. It's just been a reminder and a prompt to actually look at things that need tweaking and to make sure that we are up to date with what the current thinking is on these things.
Thank you.
Can I see whether Dr. Lambert wants to add? Yes, exactly. Thank you, Chairman.
Yes, Dr. Lambert, would you like to comment on this report?
Yeah, thank you, Chairman. Thank you. I thought it was a very meticulous, balanced, thoughtful and wise report by Stephen. Those are probably 4 words that we use about Stephen quite a lot in the time that I've come to know him. And I welcome some of the suggestions. I certainly welcome the new, fresh ideas to better integrate the independent person into the system. I do feel very supported by the Policy and Scrutiny Officer and also by Stephen in his role as Deputy Monitoring Officer. And I'm looking forward to interacting further with the new Monitoring Officer, who I think took up post on the 1st of July. I also noted in this report the need for refresher training within the councillor constituency, and I will support that. And also noting how all this fits into wider national reviews and priorities. I also noted the extensive collaboration between monitoring officers and Cornwall Council. Rather like my beloved grey seals go back and forth between Scilly and Cornwall, so it seems the monitoring officers share ideas back and forth. And I think that can only be for the greater good. And as I observed humorously in the earlier section, the Isles of Scilly do seem to have the most ethically robust councillors in the United Kingdom. And I'm very proud to serve in this independent person role, and I look forward to being perhaps better integrated into the system, as Stephen has suggested in his report, and being called upon and being more deeply engaged and more interactive with some of the thought processes and some of the policies.
Thank you very much. Any questions? Councillor Sims.
I've just can't get out of my mind thinking of Stephen as a meticulous grey seal. I think next time you come over, I'll give you some fish. It's quite good for me. I have no ethical standards and I stick by them rigidly. Good report, thank you.
Councillor Legg.
No, I have no comments specifically, but welcome the report. Thank you.
Thank you very much. Councillor Marcus. I think Councillor Marcus has left us actually. Councillor Nellens.
Thank you, Chair. Nothing to add. Very pleased to see that in the next 12 months, the additions, and particularly with the member development programme. Thank you.
Thank you. Councillor Smith.
Thank you. I'd just like to welcome this good report from our wise monitoring officer and thank you for meticulous Dr. Lambert.
Thank you. Councillor Watt.
Yeah, thank you, Chairman. It's actually quite a humorous meeting, this. No, I'm glad to see the mention of refresher courses, because the way that the government changes its mind every single day on protocols and other things, that may well be more and more necessary in the future.
Thank you. Councillor Williams.
No, nothing apart from I think certain sectors of our community would think 16 grey seals sat in the chamber could make equally as informed decisions as we do.
Thank you for that, Councillor Williams. Right, take the recommendations. 3 recommendations. Members welcome the annual report of the ethical standards regime. Members recommend to full council that the monitoring officer be authorised, in consultation with the chairman or vice chairman of the Scrutiny Committee, to determine any request for a dispensation in between meetings of the committee where it is not reasonable to defer determination until the next meeting of the committee. Members endorse.
Can I just say, Chairman, we didn't specifically actually addressed that in the discussion, and that's my fault. I do apologise. That is simply because at the moment, any request for dispensations would have to go to the committee itself. And as the committee meets less often than council, it's considered really that it would be sensible to have a mechanism to decide on dispensations, and that there should be member input into that. So that is the rationale for that, Chairman. I haven't actually been asked for any dispensations, but this is something which should be in place just in case.
Are members happy with that recommendation? Everybody has read it. Anybody not satisfied with it? No, right. Okay. And recommendation 3, members endorse the proposed work programme set out in the annual report. Could I have a proposer for all 3, please?
I'll propose all 3.
Councillor Sim, a seconder, please.
Yes, I'll second that.
Councillor Watt. All those in favour? Anyone against? Okay, that's consent. Thank you very much. Right, comes to the last agenda item, which is Scrutiny Committee Work Plan. Bob, are you going to take this?
Yes, Chairman, thank you very much.
Thank you.
Indeed, Stephen, a hard item to follow after the Ethical Standards annual report. I will take the report as read. I will make 1 or 2 comments, however. One being that this is being incorporated, the general aspects around scrutiny are being incorporated into the Departmental Service Plan for Democratic and Corporate, which will be coming to full council in July. Also, a couple of aspects around the previous work plan. The response to Health Watch Isles of Scilly regarding a multi-point referral, that's been put back largely because of the system pressures felt by our health and care partners under coronavirus, and now with the model of care contingency plans in place and moving towards this kind of outbreak recovery phase, we can maybe pick some of that up. But we've discussed already, Chairman, a letter to Paul as Chairman to provide an update on the progress and the committee's response to the evidence that Health Watch Isles of Scilly has provided. Yes, and that there remains scope between now and kind of mid-November for potentially a special meeting of the committee if something does arise that merits its calling. But I'll open the remaining debate to members. Thank you.
Right, Councillor Sims, any comments?
Yeah, my only comment really I've got is I think the further term kicking into the long grass until we're right out of this COVID woods, because I don't think we're still going to be there in November, I think, and if it involves another survey and stuff, there's going to be a lot of work for Bob, which I don't think there'd be a great deal of utility doing in the current circumstances. So I would prefer that preferably after I'm dead.
So, sorry, Steve, can I confirm which item was that was? Because it broke up at mine.
Straight 2.
Okay.
Yeah.
Well, we could actually, yes, if it could be deferred for the moment, we can revisit it at any time. We'll go around the table and see what everyone else thinks anyway. Anything else? No. Councillor Legg.
I mean, I just think the deferral for as long as it's sensible seems eminently sensible. I don't know, ask Seal.
Well, there's lots to say.
Well, sorry, it's been a long meeting and it's quite hot back here in this window and I'm starting to cook, I think.
Chairman, can I suggest we remove it from the work plan currently, and then we can review it again after in the next, probably after the elections in May 2021.
Yes, that's a good idea.
The new
If you're not
committee.
going to get anything done before then.
We're all in desperate need of some fish.
Review 2021. Any other comments, Councillor Legg?
No, other than that, very happy with the work plan.
Thank you. Councillor Marcus, I think, has left us. Councillor Nellam.
Thank you, Chair. No, very happy with the work plan and also with the suggestion by Councillor Sims that we hold off on one or two things. Thank you.
Right. Okay. Councillor Smith.
Just for a different opinion, I'm going to directly contradict Councillor Sims in saying that I think we should do phase 2 and deliver on it before the elections in May 21, because it's dragged on too long. And I think actually we spend too long looking at internal activities of the council, not enough external. I've said that many times before, and I think freight is very, very important to many people. We did a very good piece of work in phase 1, and I think the phase 2, which is looking at the couriers travel system delivering to cities, is really, really important for people. Completely accept that officers have had a lot of other things on their plate, but I don't want to see it drop off the plan, so I would not vote for that.
Okay, thank you. Councillor Watt.
Yeah, I tend to agree with Jonathan. Yeah, sorry. Can you hear me?
Yes, I can hear you.
Yes, I tend to agree with Jonathan in there. There's no reason why we can't keep it in the programme as a provisional item and then move it as accordingly.
Okay. Councillor Williams.
I'm new to all this freight game, so I've got really nothing to add to that. But my main observation would be that I think something like this for full council would be useful. Obviously, it allows us to look where we're going to be in 12 months for scrutiny. I suspect there is something for full council, but it doesn't come before my eyes. If that could be something that could be considered, I think it would be useful.
If I may come in there, Chair, it's something we've asked for at full council for a long time, and been told, yes, we'll get round to it. I don't know if Paul would like to come in on this.
Paul, are you still with us? No.
Tom? Yeah, can you hear
Tom?
me?
Yes.
I can hear you, Paul. Yeah.
Yeah. I mean, I think it's fine to leave it in the work programme for scrutiny, and go from there. To be honest with you, I think the only comment I had, Chairman, in a conversation you and I had, of course, I wouldn't like us to forget that we committed, in principle, to doing an extra special meeting of the Scrutiny Committee to consider the collaboration agreement with Cornwall before the end of the autumn. And I've given an undertaking at the board, the collaboration board last week, that we would be in a position for scrutiny to make a recommendation to November Council, in order that members can have confidence that the services we're getting from Cornwall are fit for purpose for us and are appropriate.
And perhaps if I could add to that, Chairman, I think what really Councillor Legg's talking about is a forward plan for the council. Is that right?
Yeah.
Understood. Yeah. Well, that's certainly something which Chief Executive and I have discussed, and we can push that forward.
Yeah. I think
it's been talked about for a couple of years.
Yeah. I think, Chairman, I don't know if you may indulge me just for a second. I know we've had informal conversations about this, and perhaps we can pick it up at an informal members' session one evening about the scrutiny work programme, because the bit that I'm particularly interested as well is standing back from the scrutiny work programme is our scrutiny paying attention to those things that other agencies, when they come to inspect us, might expect scrutiny to do. And the example I always give is the HMI inspection of the Fire and Rescue Service. The HMI are always critical of council-run fire services and are always critical of the governance of those services. And they always start by asking, does scrutiny scrutinise the performance of the fire service in a robust way? And that actually gives the HMI confidence that we're doing our job properly, but also protects us keeping our own service. So I just think it might be worth having an informal session just to consider, are there any inspection agencies where governance and particularly scrutiny might be subject of that inspection?
Okay.
Yeah. Chairman, just to add to that's particularly relevant for the review of scrutiny, where I now have the benefit of having had consultation with 3 different chief executives, and it's on the programme for November's meeting.
Yeah. Okay. That's everybody, isn't it? You've got all that down, Bob?
I have, yes. We can discuss the option for the special meeting date around the collaboration agreement, so that we can do that in a timely way, so that it can come to full council in November.
Right. Okay.
Any recommendation?
So we need to have that probably sometime in September, then, don't we? Do you think? Well, we'll work that out.
Yeah, September, October, definitely.
Mm-hmm.
Yeah. Okay, we work that out, and also then have an informal about fire service performance as well. Okay. Right. Recommendation that the work plan be approved, subject to any amendments made by the committee. So I have a proposer, please.
I'll propose that.
Proposed by Councillor Smith.
Do we actually need to determine what we're deciding with regard to phase 2, whether to remove it from the work plan?
Chairman, my understanding is that it will remain on the work plan as a provisional item without a specified date.
Okay, yeah, I'll happily agree to that.
Are you happy with that? Okay.
Well, actually, the recommendation is pretty open-ended, isn't it? Subject to any amendments made by the committee.
Yeah.
So we're basically approving a work plan that could be changed at any point. Without
we've got various other things in it. It's really just to approve the work plan, and then there'll be things added. So you propose. Yeah. Have a seconder, please. Councillor. Can I have a seconder? Smith, Councillor Smith. All those in favour? Anyone again? That's consent. Thank you. Now to close the meeting at 16:43. Thank you very much, everybody.
Thank you, Chairman.
Thank you.
Thanks, Avril.
Thank you. Thank you very much.
Thank you, Chairman.
Thank you, Bob.